Now, the World Health Organization has created a COVID-19 guide for children ages 8 to 17 years old. And the guide aims to help young people understand the science and social science of COVID-19, as well as help them take actions to keep themselves, their families, and communities safe. The Smithsonian Science Education Center is the co-founder and creator of the free online guide with 7 student-led activities for children and teenagers. And it's important that children are understanding what's happening around them. There's so much with them not really knowing why they're at home or how long they're going to be home for, why they can't see their friends, why they can't go out and play dates, why they can't have birthdays at Chuck E. Cheese. I mean, so many things. So it's really nice to see that they're looking at ways to help children understand what is happening around them, so it's hopefully less scary for them.
Well, you mentioned the guide is for children ages 8 to 17. The older kids, the teenagers, I don't worry too much about, or as much about, simply because they have a little bit more of an understanding of what we're enduring right now. But the really young kids are the ones, and those parents, God bless them, because they're the ones that have to explain to these young kids all the points you just mentioned, for those kids who might not have as much of a comprehension of what exactly this pandemic means and how we should go about adjusting our daily lives.
Yeah, and we just mentioned it's Memorial Day weekend. Like I said, I forgot. Calvin, our floor director, he said he didn't get any barbecue invites. Imagine kids, because we're used to these holidays. Yes. We're used to looking forward to them and being excited about it. And here, you know, the world is just kind of going by, and these things that we're all so used to looking forward to. I mean, it's Thursday, tomorrow, so it's really a long weekend, because most people would have had off, or they would have taken off Friday, tomorrow.
Right, Friday, Saturday,
and
Sunday,
yeah,
Monday.
They would have a 4-day weekend. But that's just not happening now for most people, as they're either working from home anyhow, or, you know, unfortunately they're unemployed, or they don't want to go anywhere because you don't want to go to a barbecue full of people that you don't know and possibly get sick. So whole different world, and the little ones, of course, you know, wondering why their world has been turned upside down.
No question. Well, Laverne, as you know, much of the health news regarding COVID-19 has been detailing the high risks associated with the elderly. Although schools are closed, there has been little to suggest children are in greater danger than anyone else.
But as parents, we of course worry about the health and safety of our kids, and many of us would like to know more about how to keep them from getting the virus. Joining us now to discuss immunizations and other health disparities is Dr. Rachel Thornton. She is the Associate Director of Pediatrics at the prestigious Johns Hopkins School of Medicine. Welcome to BNC Now, Dr. Thornton.
Oh, thank you so much for having me.
Well, we hear many different reports about COVID-19 and what age groups and who's at risk. How are our children affected?
Well, I mean, I think you were touching on some of the ways that children are affected just now. It's a major disruption to their everyday life. And so I think everyone who's in the vicinity of children, caring for children, living with children, is aware of that, and that can have emotional consequences, and and then there's, on top of that, there are the other consequences on children's access to healthcare services, or how people are thinking about that access. And then, of course, there's also risks associated with families where there's been exposure to COVID-19 or someone is sick. So there's many different ways that kids are affected, and really throughout the age spectrum, from infants to teenagers and young adults, there are major impacts. I think as pediatricians, one thing we really have been working hard to get across is that vaccination of children for routine vaccinations to prevent illnesses like measles and whooping cough remain essential medical services that every child should continue to have access to. It's different than the essential services that people think about in the midst of an emergency, like access to an emergency room or an ICU, but it remains essential, and we've been really trying to get the word out to ensure that vaccine rates don't go down for children during this time.
Well, as you well know, there have been some parents who have been against immunization shots for their children before this pandemic for various reasons. You went into it a little bit just a moment ago, but can you go deeper into just how important vaccinations are for our children?
Oh, absolutely. I mean, I think measles is sort of the case that may have be the most recent in people's memory. What happens when a large population of children or a significant population of children isn't vaccinated in the U.S.? This can put babies in particular at risk of infection and severe illness. Because they aren't yet old enough to get the measles vaccine. And so, in addition to protecting the children in your own household against infection, the other really important aspect of vaccination for those who can receive them is it protects the whole community from outbreaks of other diseases during COVID-19. And in particular, the American Academy of Pediatrics and pediatricians around the country have been trying to really get the word out that parents should have, confidence that health systems and healthcare entities are doing everything in their power to ensure safety when children come in for these important, essential medical services. I don't want to get too much into the fears around vaccines. I think there's a variety of different reasons why people have fears. There have been a variety of different disinformation campaigns related to that, but I think that the prevailing wisdom and the science would argue that vaccination is safe and highly recommended for all children. And in fact, the Centers for Disease Control and Prevention has recently highlighted some of the downturns in vaccination rates that occurred right at the start of the pandemic or following the start of the pandemic here in the United States. And we've been working hard to overcome that.
Now, Dr. Thornton, is there anything we can do about the racial and ethnic disparities in healthcare that, of course, obviously affect our children?
You know, that's a really important question. It's a question that predates COVID for certain, but I think that being in the midst of this pandemic, it's raised awareness and consciousness about the impact that these disparities in access to healthcare can have for people of all ages. In fact, we have seen, at least in Michigan, in one example, where potentially the decrease in vaccination rates for children who are publicly insured versus not was a little steeper. I think it's really important, and providers are doing this all around the country, to be proactive in outreaching to families who may face other challenges during COVID that make it harder for them to get into clinics. In places where transportation is limited, this can be a major impediment for populations that are not primarily English speaking, who may have limited access to providers who can communicate with them directly. That can also be a major barrier. When people have limited access to broadband and may not be able to get all of the information they need readily. It's really important that news outlets like your own do a really good job of reaching those folks to send them sound, evidence-based messages about the importance of these kinds of issues. So all of those things are some of the ways that we can overcome the access barriers, but certainly there are a variety of other barriers that affect children's health, economic conditions, housing conditions, that are also really important for us to talk more about.
All right. Well, really important information for our families, for our children. Thank you so much for joining us on BNC Now, Dr. Thornton.
Oh, you're welcome. Thank you for having me.